Namaste for all. Today I am going to do my presentation on prenatal diagnosis and fetal medicine. Prenatal diagnosis in the sense before the baby coming to an external world, the mother undergoing to identify the any problems in the unborn babies. And fetal medicines in the sense if they identify any problems, they are giving a medications to the fetus when it is there in the inside the womb itself, when it is there in the inside the womb of the mother, when it is not till take birth. And for the unborn babies they are giving a medications. This is the unit number 2 and comes under the session 22. And the main objective of my study is to explain the role of pre-diagnostic method. My main intention is to explain the importance and the role of pre-diagnostic methods. What are all the importance once they, if they goes for a pre-diagnosis, if they goes for a diagnostic method before the birth takes place, before the birth takes place, or the baby comes into an external world. What are all the importance of once they know the importance of pre-diagnostic methods is important. The importance of this I want to explain. And to understand the use of advanced scientific technology to avoid the abnormalities in an unborn baby. See, the pre-diagnostic methods is nothing but before the baby is taken into the external world, they are diagnosing the problem inside the baby and in the unborn baby. Once they know this technology once they know by the help of advanced scientific technology, there are so many technologies are there. See, ultrasound is there, x-ray there. So by through this, if they identify the problems, they can avoid the abnormalities in an unborn child. By giving a medicines, they can avoid the abnormalities. They can give a birth to a normal baby. So next one is the main outcomes. What are all the outcomes I am expecting from the student after my sessions? See, once they attend the session, they should be able to understand the role of pre-diagnostic method. What is the main importance of pre-diagnostic method before the baby takes into the birth? They can identify the disorders in the baby by different methods. That methods I will explain. And they should demonstrate the knowledge about the use of advanced scientific technology to the society. They can demonstrate their knowledge about the scientific technology. Now so many advanced technological world is there. So because of that, they can avoid the abnormalities in an unborn child. Before the baby coming to an external world, they can avoid the abnormality, and they can expect they can change into an normality. They can find the normalities because of the scientific technology. Once they identify the abnormalities in the child, they can give the fetal medications or the medications to avoid the abnormalities in the unborn child, and they can turn into an abnormalities. And to help oneself and the others, by knowing this, they can help oneself to the family as well as to the society. Also they can spread the knowledge about this advanced pre-diagnostic methods, advanced scientific technologies. So my contents are, see, there are introduction I have mentioned about the pre-diagnostic method, then prenatal diagnosis. What do you mean by the prenatal diagnosis? Then the bone marrow transplants, then genetic engineering, then references, what are all the books I have referred, then MCQs, multiple choice questions. So this will help for your exams, but I didn't mention the answers. That is an assignment for you. Throughout this session itself, you will find out the answers. So my first one is the introductions about the pre-diagnostic method. See, if the couples who might bear an abnormal child decide to conceive and go through this method. See, if the couples already know that, or through the X-ray or through the scanning, they comes to know that there is a chances of they are giving to birth to an abnormal child. They want to decide to conceive and go through this method. They are going to check this method, and they're going through this method. See, there are most prenatal diagnostic methods are prenatal diagnostic ಅಂದ್ರೆ ಯಾವ ದಂಪತಿಗಳಿಗೆ ಅವರಿಗೆ ಅಪಸಾಮಾನ್ಯ ಮಗು ಹುಟ್ಟುವಂತ ಸಾಧ್ಯತೆ ಇದೆ ಅಂತ ತಿಳಿತದೋ ಅವರು ಈ ವಿಧಾನವನ್ನು ಅನುಸರಿಸ್ತಾರೆ. ಅಂದ್ರೆ ಪ್ರಿನೇಟಲ್ ಡಯಾಗ್ನೋಸ್ಟಿಕ್ ಮೆಥಡ್ಸ್ ಇಸ್ ನಥಿಂಗ್ ಬಟ್ ಮೆಡಿಕಲ್ ಪ್ರೊಸೀಜರ್ಸ್, ಇದು ವೈದ್ಯಕೀಯ ಸಾಧನಗಳಿದೆ that permit detection of problems in the unborn child before the birth takes place. This detect and this identify the problems in unborn child. So it's a medical procedures are there. So this permits the detect and identify. This identifies the whether there is a problem in unborn child or not, whether the child is normal or abnormal. So the next one is women of advanced maternal age are prime candidates for amniocentesis. Women who are advanced maternal ages, see, women who are coming to an maternal ages, advanced maternal ages, who are very teenagers or who are already crossed the maternal age are prime candidates, who are the main candidates for amniocentesis kinds of synthesis kinds of pre-diagnostic methods. ಆಮ್ನಿಯೋಸಿಂಥಸಿಸ್ಗೆ ಆಮ್ನಿಯೋಸಿಂಥಸಿಸ್ ಅಂತಾನೆ ಹೇಳ್ತಾರೆ, ಕನ್ನಡದಲ್ಲಿ ಅದಕ್ಕೆ ಅರ್ಥ ಇಲ್ಲ. ಒಂದು ವೇಳೆ ತಿಳಿದುಕೊಂಡಲ್ಲಿ ನಾನು ಅದನ್ನು ಹೇಳ್ತೇನೆ ಅಷ್ಟೇ, ಕನ್ನಡದಲ್ಲಿ ಯಾವ ಟರ್ಮ್ ಇದೆ ಅಂತ. women of advanced maternal age are prime candidates. ಯಾರೆಲ್ಲ ಬೇಗ ತಾರುಣ್ಯ ಅವಧಿಯಲ್ಲಿ ಮದುವೆ ಆಗಿರ್ತಾರೋ ಅಥವಾ ತುಂಬ ಲೇಟಾಗಿ ಮದುವೆ ಆಗಿರ್ತಾರೋ ಅವರೇ ಮುಖ್ಯವಾದ ಅಭ್ಯರ್ಥಿಗಳಾಗಿರ್ತಾರೆ ಈ ಆಮ್ನಿಯೋಸಿಂಥಸಿಸ್ಗೆ. ದಿಸ್ ಆಮ್ನಿಯೋಸಿಂಥಸಿಸ್ ಆಲ್ಸೋ ಕಾಲ್ಡ್ ಆಸ್ ಕ್ರೋನಿಕ್ ವಿಲ್ಲಸ್ ಸ್ಯಾಂಪ್ಲಿಂಗ್ ಅಂತ, ಅಂದರೆ ಕ್ರೋನಿಕ್ ವಿಲ್ಲಸ್ ಮಾದರಿ ಅಂತಲೇ ಹೇಳ್ತಾರೆ, ಕ್ರೋನಿಕ್ ವಿಲ್ಲಸ್ ಮಾದರಿ. ದೆನ್ ಎಕ್ಸೆಪ್ಟ್ ಫಾರ್ ಅಲ್ಟ್ರಾಸೌಂಡ್ ಆ್ಯಂಡ್ ಮೆಟರ್ನಲ್ ಬ್ಲಡ್ ಅನಾಲಿಸಿಸ್, ಸಿ except this is not including the ultrasound scanning or the maternal blood sampling method. Maternal, they are not taking the ultrasound ಆಗಿರ್ಬೋದು ಅಥವಾ ತಾಯಿಯ ರಕ್ತದ ಸಹಾಯದಿಂದ ತಗೊಳ್ಳುವಂಥ ವಿಶ್ಲೇಷಣೆ ಅಲ್ಲ, ತಾಯಿಯ not taking the samples of maternal blood in this method. So prenatal diagnosis should not be used routinely. See, prenatal diagnosis, this diagnosis method they are not used to do routinely. Again and again they are not using. Why? Because this is ultrasound or any kinds of methods, sorry, not only the ultrasound but also because of the other scanning methods are they are adopting. So that scanning may harmful for the unborn baby. That is the reason why that they are not using routinely this method. So that prenatal diagnosis to identify the baby's abnormalities they are not using again and again. ಅವರು ಈ ವಿಧಾನವನ್ನು ಮತ್ತೆ 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 ಬಳಸುವುದಿಲ್ಲ. ಜನನ ಪೂರ್ವ ಮಗುವಿನ ರೋಗವನ್ನು ಪತ್ತೆ ಹಚ್ಚುವ ವಿಧಾನವನ್ನು ಮತ್ತೆ 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 ಬಳಸುವುದಿಲ್ಲ. ಯಾಕೆಂತ ಹೇಳಿದ್ರೆ ದಿಸ್ ಇಸ್ ವೆರಿ ಡೇಂಜರಸ್ ಫಾರ್ ದ ಬೇಬಿ, ಸಿನ್ಸ್ ಅದರ್ ಮೆಥಡ್ಸ್ ಹ್ಯಾವ್ ಅ ಚಾನ್ಸ್ ಆಫ್ ಇಂಜೂರಿಂಗ್ ದ ಬೇಬೀಸ್ ಬ್ರೈನ್. ಸೊ ದೇ ಮೇ ಬಿ ಅ ಚಾನ್ಸಸ್ ಆಫ್ injuring or may occur problems. There may chances of problems or dangerous happens for the unborn baby. ಅದರಲ್ಲಿ ಯಾವುದಾದ್ರೂ ಅಪಾಯಕಾರಿ ಬರಬಹುದು ಈ ವಿಧಾನದಿಂದಾಗಿ. ಆದ ಕಾರಣ ಇನ್ನು ಹುಟ್ಟದೆ ಮಗುವಿಗೆ, ಫಾರ್ ದಿ ಅನ್ಬಾರ್ನ್ ಬೇಬಿ, ಇನ್ನು ಹುಟ್ಟದೇ ಇರುವ ಮಗುವಿಗೆ ಗರ್ಭದಲ್ಲೇ ಇರಬೇಕಾದ್ರೆ ಏನಾದರೂ ಸಮಸ್ಯೆ ಬರಬಹುದು ಅಂತ ಎಂಬ ಕಾರಣಕ್ಕೆ ದೇ ಆರ್ ನಾಟ್ ಯೂಸಿಂಗ್ ದಿಸ್ ಮೆಥಡ್ ಅಗೇನ್ ಆ್ಯಂಡ್ ಅಗೇನ್. And then the prenatal diagnosis has led to advances in fetal medicine. See, prenatal diagnosis has led to advances in fetal medicines. Prenatal diagnosis they are used to advances fetal, andre once they identify the problems they are led to advances in before itself. So once they identify the problems in the unborn baby they are using in advance fetal medicines. They are using the medicines to avoid the abnormalities. For example, by inserting a needle into a uterus, by inserting the needle, they are inserting the needle into the mother's uterus, and doctors can administer the drugs to the fetus in the sense unborn baby. See, by inserting a needle, through the needle they are using a medicines for that. They are using a particular medicines and they are inserting into the uterus, and doctors can administer by inserting it to the uterus there is a fetus is there. the drugs goes to the fetus. So they are using, see ಇಲ್ಲಿ ಅವರು ಇಂಜೆಕ್ಷನ್ ಅನ್ನು ಬಳಸ್ತಾರೆ. ಅವರು ಇಂಜೆಕ್ಷನ್ ಅನ್ನು, ಆ ಸೂಜಿಯನ್ನು ಮಗು ತಾಯಿಯ ಗರ್ಭದೊಳಗೆ ಹಾಕ್ತಾರೆ. ಗರ್ಭದೊಳಗೆ ಹಾಕ್ಬೇಕಾದ್ರೆ ವೈದ್ಯರು ಅದರಲ್ಲಿ ಡ್ರಗ್ಸ್ ಅಥವಾ ಔಷಧಿಯನ್ನು ಹಾಕ್ತಾರೆ. ಡ್ರಗ್ಸ್ ಅಂದರೆ ಡೋಂಟ್ ಟೇಕ್ ಇಟ್ ಇನ್ ಅ ನೆಗೆಟಿವ್ ವೇ. Drugs in the sense medicines, they are using a medicines, they are putting a medicines to the fetus, ಭ್ರೂಣದೊಳಗೆ ಹಾಕ್ತಾರೆ ಅದನ್ನು ಇಂಜೆಕ್ಟ್ ಮಾಡುವ ಮೂಲಕ. ಸೊ ಸರ್ಜರಿ ಹ್ಯಾಸ್ ಬಿನ್ ಪರ್ಫಾರ್ಮ್ ಟು ರಿಪೇರ್ ಸಚ್ ಪ್ರಾಬ್ಲಮ್ಸ್. ಸೊ ಸರ್ಜರಿ ಆಲ್ಸೋ ಹೆಲ್ಪ್ ಟು ಪರ್ಫಾರ್ಮ್ ಟು, ದಟ್ ಈಸ್ ಆಲ್ಸೋ ಹ್ಯಾಸ್ ಬೀನ್ ಪರ್ಫಾರ್ಮ್ ಟು ರಿಪೇರ್ ಸಚ್ ಪ್ರಾಬ್ಲಮ್ಸ್. ಸರ್ಜರಿ ಕೂಡ ಮಾಡಬಹುದು, ಅದರಿಂದ ಕೂಡ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಯನ್ನು ಕೂಡ ಮಾಡ್ತಾರೆ. ಸಮಟೈಮ್ಸ್ ದೇ ಆರ್ ಯೂಸಿಂಗ್ ದ ಇನ್ಸ್ಟ್ರೂಮೆಂಟ್ಸ್ ಆರ್ ಸರ್ಜರಿ ಹ್ಯಾಸ್ ಬಿನ್ ಆಲ್ಸೋ ಪರ್ಫಾರ್ಮ್ ಟು ರಿಪೇರ್ ಸಚ್ ಪ್ರಾಬ್ಲಮ್ಸ್. ಇಫ್ ದೇರ್ ಈಸ್ ಎನಿ ಕೈಂಡ್ಸ್ ಆಫ್ abnormal problems, they are using surgery or else the medicines. ಕೆಲವು ಸಲ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಯನ್ನು ಕೂಡ ಮಾಡ್ತಾರೆ ಯಾವುದಾದ್ರೂ ಸಮಸ್ಯೆಯನ್ನು ತಡೆಗಟ್ಟಲಿಕ್ಕೆ ಮಗುವಿನಲ್ಲಿ ಇರುವಂಥದ್ದನ್ನು. ದೆನ್ ದಿ ಸರ್ಜರಿ ಎಸ್ಪೆಷಲಿ ಫಾರ್ ದಿ ಹಾರ್ಟ್, ಲಂಗ್ಸ್ ಆ್ಯಂಡ್ diaphragm malformation. If there is any kinds of problem related to the heart, lungs and diaphragm in the sense, the diaphragm is nothing but a thin cover of the baby. Heart, lung and thin cover of the baby. If there is any problems in the thin cover which covers the baby's body, that is also they are injecting the medicines for that also. Then the problems in the urinary tract obstructions. If the babies can't able to urinary tract will not functions in a very well manner, for that also they are injecting the medicines. And the neural defects in the sense, if the baby has any kinds of problem related to the nerves or neurons, any kinds of deficiency, then for that also they are using this medicines, this kinds of medicines. Then the tumors of the tailbone, if anything happens, tumor cells ಬೆಳೀತದೆ ಕೆಲವು ಸಲ tumor cells. If there is tumor cells grown in the tailbone, very tailbone in the tailbone, on the very thin bone of the baby, and tumors ಎಲ್ಲಾದರೂ ಬೆಳೆದ್ರೆ ಮಗುವಿನ ಎಲುಬಿನಲ್ಲಿ ಈ ಟೈಲ್ ಬೋನಲ್ಲಿ, ತೆಳುವಾದ ಎಲುಬಿನಲ್ಲಿ ಏನಾದರೂ ಟ್ಯೂಮರ್ಸ್ ಬೆಳೆಯುವಂಥ ಸಾಧ್ಯತೆ ಇದೆ. ಅದಕ್ಕಾಗಿಯೂ ಈ ವಿಧಾನವನ್ನು ಅನುಸರಿಸ್ತಾರೆ, ಸರ್ಜರಿ ವಿಧಾನವನ್ನು ಅನುಸರಿಸ್ತಾರೆ. ಏನಾದರೂ ಹಾರ್ಟಲ್ಲಿ ಏನಾದರೂ ಸಮಸ್ಯೆ ಇದ್ದರೆ, ಹೃದಯದಲ್ಲಿ, ಲಂಗ್ಸಲ್ಲಿ ಏನಾದರೂ ಸಮಸ್ಯೆ ಇದೆ. ಫಾರ್ ಎಕ್ಸಾಂಪಲ್, ಒನ್ ಆಫ್ ಮೈ ರಿಲೇಟಿವ್ ಹ್ಯಾಸ್ ಅ ಪ್ರಾಬ್ಲಮ್. Relatives got the problem in the heart before the baby comes into they identify the problems before the baby comes into an external world. So they have gone through the pre-diagnostic method. Once the doctor identified this problem inside the womb itself, they made a surgery for the baby. So in the lungs also the same problems, same kinds of methods they are using. And diaphragm in the sense, that is a thin cover which protects the baby. If there is a problems in this or the malformation of this cover, also they are giving a surgery, they are undergoing for a surgery. If the urinary tract obstructions, one of my friends baby has got the problem over in the urinary tract. After taking the birth, once the baby comes to an external world, they diagnose this problem, urinary tract problem. But the baby, when the baby is inside the womb itself, the doctor can identify the problem, and they can solve the problem inside itself by giving a surgery. Some kinds of surgeries not depends on by using the instruments or using this one. Laser treatment also they used to give if the urinary tract is not functioning in a well manner. urinary ಅಂದ್ರೆ ಮೂತ್ರದ ನಾಳ ಸರಿಯಾಗಿ ಕೆಲಸ ಮಾಡದಿದ್ರೆ, ದೆನ್ ನ್ಯೂರಲ್ ಡಿಫೆಕ್ಟ್ಸ್ ಅಂತ ಹೇಳಿದ್ರೆ ನರದ ವ್ಯವಸ್ಥೆಗಳು ಏನಾದರೂ ಸರಿ ಇಲ್ಲದಿದ್ರೆ, ಅಥವಾ ಟೈಲ್ ಬೋನ್ ಟ್ಯೂಮರ್ಸ್ ಆಫ್ ದ ಟೈಲ್ ಬೋನ್, ಎಲ್ಲಾದರೂ ಬೋನಿನಲ್ಲಿ ಅಥವಾ ಇದರಲ್ಲಿ ಎಲುಬಿನಲ್ಲಿ ಎಲ್ಲಾದರೂ ಟ್ಯೂಮರ್ಸ್ ಸೆಲ್ ಉದ್ಭವ ಆದರೆ ಅದನ್ನು ಕೂಡ ದೇ ಯೂಸ್ ಟು take or they used to cut with the help of a surgery. And fetuses with the blood disorders have been given blood transfusions. This is also I have gone through one baby. I know these problems with the one of my friend's friend, and she has undergone with this problem. She has a problem of a blood infections. So for each every month they are going to change the blood. For every month she is undergoing to change the blood transfusions also happens. ನೋಡಿ ಏನಾದರೂ ಫೀಟಸ್ ಭ್ರೂಣದಲ್ಲಿ ಇರಬೇಕಾದ್ರೆ ಬ್ಲಡ್ ರಕ್ತ ಸಂಬಂಧಿತ ಸಮಸ್ಯೆಗಳು ಬರ್ತದೆ. ಸೊ ಟು ಪ್ಯೂರಿಫೈ ದಿ ಬ್ಲಡ್ ದೇ ಆರ್ ಗೋಯಿಂಗ್ ಫಾರ್ ದಿ ಬ್ಲಡ್ ಟ್ರಾನ್ಸ್ಫ್ಯೂಷನ್. ಬ್ಲಡ್ ಅನ್ನು ಬದಲಾಯಿಸ್ತಾರೆ, ರಕ್ತವನ್ನು ಬದಲಾಯಿಸುವ ಕೆಲಸವನ್ನು ಮಾಡ್ತಾರೆ ಪ್ರತಿ ತಿಂಗಳಿಗೆ ಅಥವಾ 2 ತಿಂಗಳಿಗೆ ಒಂದ್ಸಲ, ಒನ್ಸ್ ಇನ್ ಅ ಮಂತ್ ಆರ್ ಒನ್ಸ್ ಇನ್ 2 months. So this is also happens. Then those with the immune deficiency, see those who have if the child has a problem in immune deficiencies, immune deficiency in the sense lack of immune system, ರೋಗ ನಿರೋಧಕ ಶಕ್ತಿ ಕಡಿಮೆ ಇರ್ಬೋದು. If the baby has not enough capacity to fight with the any disorder, or if the baby has a lack of immune system, immune capacity, have received the bone marrow transplant, it is easily called as a VMT. This method is especially done by the doing in a way that they are taking the bone marrow by the same child's siblings. By the same child's siblings they are taking the bone marrow and they are injecting to this unborn baby. So BMT that succeeded in creating a normally functioning immune system. So this BMT technique is more helpful and more succeeded in creating a normally functioning immune system. This helps to and this increases the immune system of the baby, and this normals the immune system of the baby. ನೋಡಿ ಬೋನ್ ಮ್ಯಾರೋ ಮೆಥಡ್ ಅಂತ ಹೇಳುವಂಥದ್ದು, ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ಸ್ ಮೆಥಡ್ ಏನು ಅಂತ ಹೇಳುವಂಥದ್ದು, ಇದು ಸಾಮಾನ್ಯವಾಗಿ ಯಾರಿಗೆಲ್ಲ ರೋಗ ನಿರೋಧಕ ಶಕ್ತಿ ತೀರಾ ಕಡಿಮೆ ಇರ್ತದೋ, ಸರಿಯಾದ ರೀತಿಯಲ್ಲಿ ಕೆಲಸ ಮಾಡೋದಿಲ್ವೋ ಅವರಿಗೆ ಈ ರೀತಿಯಾದಂಥ ವಿಧಾನವನ್ನು ಬಳಸ್ತಾರೆ. ಎಸ್ಪೆಷಲಿ ಯಾರಿಗೆ ಅಂತ ಹೇಳಿದರೆ, ಯಾರ ಮುಖಾಂತರ ಹೇಳಿದ್ರೆ ದೇ ಆರ್ ಟೇಕಿಂಗ್ ದ ಬೋನ್ ಮ್ಯಾರೋ ಫ್ರಮ್ ದೇರ್ ಎಲ್ಡರ್ ಬ್ರದರ್ ಆರ್ ದೇರ್ ಓನ್ ಸಿಬ್ಲಿಂಗ್ಸ್. ಅವರ ಒಡ ಹುಟ್ಟಿದವರಿಂದನೇ ದೇ ಆರ್ ಟೇಕಿಂಗ್ ದಿ ಬೋನ್ ಮ್ಯಾರೋ ಫ್ರಮ್ ದೇರ್ ಸಿಬ್ಲಿಂಗ್ಸ್, ದೇರ್ ಓನ್ blood related in the same baby, same mother's baby. ಅದು ಒಂದೇ ತಾಯಿಯ ಗರ್ಭದಲ್ಲಿ ಹುಟ್ಟಿರುವಂಥ ಮಗುವಿನ ಬೋನ್ ಮ್ಯಾರೋ ದೇ ಆರ್ ಟೇಕಿಂಗ್, ದೆನ್ ದೇ ಆರ್ ಇಂಜೆಕ್ಟಿಂಗ್ ಟು ದಿ ಅನ್ಬಾರ್ನ್ ಬೇಬಿ. ಇನ್ನು ಹುಟ್ಟದ ಮಗುವಿಗೆ ಅದನ್ನು ಹಾಕ್ತಾರೆ. ದೆನ್ ದೇ ಕ್ಯಾನ್ ಇಂಪ್ರೂವೈಸ್ ದಿ ಇಮ್ಯೂನ್ ಸಿಸ್ಟಮ್. Through this method they can improve or they can avoid the immune deficiencies. ಈ ರೋಗ ನಿರೋಧಕ ಶಕ್ತಿಯ ರೋಗವನ್ನು ಕಡಿಮೆ ಮಾಡಬಹುದು. Then they can increase the immune system of the baby. ರೋಗ ನಿರೋಧಕ ಶಕ್ತಿಯನ್ನು ಜಾಸ್ತಿ ಮಾಡಬಹುದು. These techniques frequently result in complications such as premature labor and miscarriages. This technique is frequently result in, see there is also a problems occur because of this method. See premature labor also happens, premature birth may taken place, or miscarriage also happens. Baby may die in the womb itself, or miscarriages ಗರ್ಭಪಾತವಾಗುವಂಥ ಸಾಧ್ಯತೆ ಇದೆ. ಅಥವಾ ಪ್ರೀಮೆಚೂರ್ ಲೇಬರ್, ಬೇಬಿ may takes place or baby taken into an external world before the 9 months, before they complete the 9 months, either in a 6 or 7 months also they may come to an external world, they take the birth. ಅಂದರೆ ಪ್ರೀಮೆಚೂರ್ ಲೇಬರ್ ಆಗುವಂಥ ಸಾಧ್ಯತೆ ಇದೆ. ಮಗು ಸಂಪೂರ್ಣವಾಗಿ ಗರ್ಭದಲ್ಲಿ ಹುಟ್ಟುವುದಕ್ಕಿಂತ ಗರ್ಭದಲ್ಲಿ ಬೆಳವಣಿಗೆ ಆಗುವುದಕ್ಕಿಂತ ಮೊದಲೇ ಮಗು ಹುಟ್ಟುವ ಸಾಧ್ಯತೆ ಇದೆ ಮತ್ತು ಗರ್ಭಪಾತವಾಗುವ ಸಾಧ್ಯತೆ ಕೂಡ ಇದೆ. Then yet parents may be willing to try almost any option, even one with only a chance of success. See, yet because of this, yet the parents, even though any kinds of problems, the parents may be willing to try almost any kinds of options. They are ready to do any kinds of options, even one with or the other kinds of method they are trying to get a chance, to get a success. There may be a chance of success for their baby. They may give a birth for the baby, normal kinds of baby. Because of that they are ready to try any kinds of options. ಈ ವಿಧಾನದಲ್ಲಿ ದೇ ಹೆತ್ತವರು ಯಾವ ವಿಧಾನವನ್ನು ಬೇಕಿದ್ರೂ ಅನುಸರಿಸಲಿಕ್ಕೆ ರೆಡಿ ಇದ್ದಾರೆ. ದೇ ಆರ್ ರೆಡಿ ಟು ಟೇಕ್ ಎನಿ ರಿಸ್ಕ್ ಫಾರ್ ಅ ಚಾನ್ಸ್ ಆಫ್ ಸಕ್ಸಸ್. ಯಾವುದಾದ್ರಲ್ಲೂ ಅಥವಾ ಒಂದರಲ್ಲಿ ಯಶಸ್ಸು ಬರಬಹುದು ಅಂತ ದೇ ಆರ್ ರೆಡಿ ಟು ಟೇಕ್ ದಿ ರಿಸ್ಕ್. ಸೊ ದೇ ರೆಡಿ ಟು ಟೇಕ್ ಸಿ ದಿ ಸಕ್ಸಸ್ ಚಾನ್ಸ್ ಆಫ್ ದಿ ಸಕ್ಸಸ್. ದೇ ಆರ್ ವಿಲ್ಲಿಂಗ್ ಟು ಟ್ರೈ ಆಲ್ಮೋಸ್ಟ್ ಎನಿ ಆಪ್ಷನ್ಸ್. ಯಾವುದಾದ್ರೂ ಒಂದು ವಿಧಾನವನ್ನಾದರೂ ಮಾಡ್ತಾ ಇರ್ತಾರೆ ಅವರು. Then currently the medical profession is struggling with how to help the parents make informed decisions about the fetal surgery. So the medical professions, it is the very challenges for the medical professions. See, they are it is to convince the parents is a very difficult problems for the medical professions. Why? Because they are struggling now with how to help the parents, how to know them, how to acknowledge them about the disadvantages of these methods. It is a very difficult or very challenging professions for the medical practitioners, and make informed decisions, how to take the decisions about the fetal surgery. It is also very dangerous for the unborn baby. So this is how to convince or how to counsel the parents is a very difficult job for the medical professions, especially informing how they are ready to take a decisions. But if they used to take the medicines, what are all the problems may occur to them, how to convince them, how to convey these messages to them is a major problem for the medical professions. See here, ಇಲ್ಲಿ ಯಾವುದೇ ಕಾರಣಕ್ಕೂ ತಂದೆ ತಾಯಿಯರನ್ನು ಕನ್ವಿನ್ಸ್ ಮಾಡಲಿಕ್ಕಾಗಲಿ, ಅವರನ್ನು ಈ ಜ್ಞಾನವನ್ನು ಒದಗಿಸಿ ಅವರ ನಿರ್ಧಾರವನ್ನು ಆಗ್ಲಿಕ್ಕೆ ಸಾಧ್ಯವಾಗಿರುವುದಿಲ್ಲ. ಅದೇ ತುಂಬಾ ದೊಡ್ಡ ಸಮಸ್ಯೆ ಆಗಿದೆ ಈಗಿನ ವೈದ್ಯರಿಗೆ. ಸೊ ದೇ ಆರ್ ಸ್ಟ್ರಗ್ಲಿಂಗ್ ವಿತ್ ಹೌ ಟು ಹೆಲ್ಪ್ ದ ಪೇರೆಂಟ್ಸ್. ದೇ ಡೋಂಟ್ ನೋ ಹೌ ಟು ಹೆಲ್ಪ್ ದ ಪೇರೆಂಟ್ಸ್ ಟು ಮೇಕ್ ಇನ್ಫಾರ್ಮ್ಡ್ ಡಿಸಿಷನ್ಸ್, ಹೌ ಟು ಟೇಕ್ the decisions. They are very helpless, they become very helpless in this sessions. Medical professions are helpless, and it is a very challenging job for them to convince the parents or inform the parents about the fetal surgery. What are all the problems or what are all the disadvantages happens or advantages happens in this. ಅಂದ್ರೆ ಈ ಭ್ರೂಣದ ಸರ್ಜರಿಯಲ್ಲಿ, ಭ್ರೂಣದ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆಯಲ್ಲಿ ಏನೆಲ್ಲ ಸಮಸ್ಯೆಗಳಾಗ್ಬೋದು, ಯಾವ ನಿರ್ಧಾರವನ್ನು ತಗೊಳ್ಬೇಕು ಅಂತ ಹೇಳೋದ್ರಲ್ಲಿ ಈ ಮೆಡಿಕಲ್ ಅಂದ್ರೆ ವೈದ್ಯಕೀಯ ಕೆಲಸ ಮಾಡುವವರು ತುಂಬಾ ದೊಡ್ಡ ಸವಾಲನ್ನೇ ಎದುರಿಸಬೇಕಾಗ್ತದೆ. ದೆನ್ ದಿ ಜೆನೆಟಿಕ್ ಇಂಜಿನಿಯರಿಂಗ್ ಆಲ್ಸೋ ಆಫರ್ ನ್ಯೂ ಹೋಪ್ ಫಾರ್ ಕರೆಕ್ಟಿಂಗ್ ಹೆರಿಡಿಟರಿ ಡಿಫೆಕ್ಟ್. ಸಿ genetic engineering, most of you have heard about this genetic engineering. Genetic engineering is nothing but because of the because of the genes or because of the chromosomes, there is the abnormality occurs for the unborn baby or the newly born baby. So genetic engineering, which helps and which gives the hopes for the parents to correct the hereditary defects, which avoids and which corrects the hereditary defects. See, hereditary defects in the sense inherited problems. Once if the grandmother or the grandparents have the problems, or if the mother or the father has a problems, that will be carried forward for their unborn baby or the newly coming baby. So this genetic engineering, which corrects the hereditary defects or hereditary diseases, ಈ genetic ತಂತ್ರಜ್ಞಾನ ಅಂತ ಹೇಳುವಂಥದ್ದು ಬೇರೆ ಏನೂ ಅಲ್ಲ, ವಿಚ್ ಗಿವ್ಸ್ ನ್ಯೂ ಹೋಪ್ಸ್ ಫಾರ್ ದ ಪೇರೆಂಟ್ಸ್ ದಟ್ ಕರೆಕ್ಟಿಂಗ್ ದಿ ಹೆರಿಡಿಟರಿ ಡಿಫೆಕ್ಟ್ಸ್, ಅಂದರೆ ಅನುವಂಶೀಯವಾಗಿ ಬರುವಂಥ ಸಮಸ್ಯೆಗಳನ್ನು ತಡೆಗಟ್ಟುವಲ್ಲಿ ಈ ಸಮಸ್ಯೆ, ಈ ವಿಧಾನ, ಜೆನೆಟಿಕ್ ಅನುವಂಶೀಯ ತಂತ್ರಜ್ಞಾನ ಅಂತ ಹೇಳುವಂಥದ್ದು ತುಂಬ ರೀತಿಯಲ್ಲಿ ಸಹಾಯ ಮಾಡ್ತದೆ. ವಿಚ್ ಗಿವ್ಸ್ ಅ ನ್ಯೂ ಹೋಪ್ ಆ್ಯಂಡ್ ದೆನ್ ನ್ಯೂ enthusiastically the parents develops and parents follow this method. Most of the doctors also enthusiastically, they are very happily follows this method, which gives a new hope for them to, which avoids the and which corrects the hereditary defects. What all the inherited problems may occur for the coming baby, they can avoid problems and they can correct the defects in the newly coming baby. They can change into a normal baby. And Human Genome Project, this is one of the project, an ambitious kind of project. See, the research programs, it's a research program, it's nothing but a research problems. Human Genome Project, I don't know the meaning, I don't know the exact word in Kannada, So I searched there in the Google itself. I didn't find the Kannada word for this. An ambitious one. This gives the most hope for the parents. A research program. It's a kind of a research program. ಇದು ಏನಲ್ಲ, ಇದೊಂದು ಸಂಶೋಧನಾ ಕಾರ್ಯಕ್ರಮ ಅಥವಾ ಸಂಶೋಧನಾ ವಿಧಾನ ಅಂತ ಹೇಳ್ಬೋದು. ಏಮ್ಡ್ ಅಟ್ ಇಟ್ಸ್ ಮೇನ್ ಗೋಲ್ ಆಫ್ ದಿಸ್ ಇಸ್ deciphering a chemical makeup of human genetic engineering. Chemical makeup, DNA, changing the DNA makeup of genetic engineering. It's a kind of genetic engineering. They are changing here the DNA of the baby, or DNA, or they are changing the DNA or the genes of the baby. Chemical makeup of, say, in the DNA there is adenine, guanine, cytosine, adenine, guanine, thymine, cytosine. Is the four kinds of chemical substances there. They are just making a chemical, they are just repairing this chemical makeup. They are just ಅಲ್ಲಿ ಏನು ಮಾಡ್ತಾರೆ ಅಂತ ಹೇಳಿದ್ರೆ ಸಣ್ಣದಾದಂಥ ಒಂದು ಬದಲಾವಣೆ ಮಾಡ್ತಾರೆ. ಇಲ್ಲಿ ರಾಸಾಯನಿಕ ವಸ್ತುವಿನ ಸಣ್ಣದಾದಂಥ ಬದಲಾವಣೆಯನ್ನು ಮಾಡ್ತಾರೆ. ಆ ಬದಲಾವಣೆಯನ್ನು ಮಾಡುವ ಮೂಲಕ through this, by deciphering or by changing this chemical makeup, they can they can hope, they can give a hope for the parents. They can give a birth to a normal baby through the genetic engineering. This is also a kind of genetic engineering. ಇದು ಕೂಡ ಒಂದು ಅನುವಂಶೀಯ ತಂತ್ರಜ್ಞಾನ ಅಂತ ಹೇಳ್ಬೋದು. Chemical substance, because of this chemical substance also there is a problems occur for the newly coming baby. By changing the chemical makeup, by changing or by repairing the chemical makeup, just repairing, they are just ಬರೀ ಒಂದು ರಾಸಾಯನಿಕದಲ್ಲಿ ಕೆಲವು ಬದಲಾವಣೆಗಳನ್ನು ಮಾಡ್ತಾರೆ. ಅದು ಮಾಡುವ ಮೂಲಕ ನಾರ್ಮಲ್ ಸಾಮಾನ್ಯ ಮಗುವಿಗೆ ಜನನ ನೀಡುವಂತೆ ಮಾಡ್ತಾರೆ. ದೆನ್ ದ ಮೇಜರ್ ಗೋಲ್ ಆಫ್ ದ್ಯಾಟ್ project is to understand the estimated 4,000 human disorders. See, there is a more and more, see the genetical problems, more and more, 4,000 human disorders are there. 4,000 human disorders, 4,000 ಮಟ್ಟಿಗೆ ಮನುಷ್ಯನಲ್ಲಿ ರೋಗಗಳು ಬರ್ತವೆ. The major goal of that project is to understand the estimated 4,000 human disorders. The major goal of this project, see, this is a project and research also taken place in this project, human genome project. ಈ ಪ್ರಾಜೆಕ್ಟ್ ಅಲ್ಲಿ ಏನು ಅಂತ ಹೇಳಿದ್ರೆ ಮೇನ್ ಗೋಲ್ ಅಂತ ಹೇಳಿದ್ರೆ, the main goal of this project is to understand the estimated 4,000 human disorders. ಅಂದ್ರೆ 4,000 ವಿಧಾನದ ರೋಗಗಳನ್ನು ಪತ್ತೆ ಹಚ್ಚಿ ಅದಕ್ಕೆ ಔಷಧಿಗಳನ್ನು ಪತ್ತೆ ಹಚ್ಚುವುದೇ ಈ ವಿಧಾನದ ದ ಹ್ಯೂಮನ್ ಜೆನೋಮ್ ಪ್ರಾಜೆಕ್ಟ್ ಇದ್ದು ಮುಖ್ಯ ಉದ್ದೇಶ. ಏನು ಅಂತ ಹೇಳಿದ್ರೆ, ಡ್ಯೂ ಟು ಜೀನ್, ಸೊ ಬಿಕಾಸ್ ಆಫ್ ದ ಜೀನ್ ಇಟ್ಸ್ ಅ ಕೈಂಡ್ಸ್ ಆಫ್ ಜೆನೆಟಿಕ್ ಇಂಜಿನಿಯರಿಂಗ್ ಪ್ರಾಡಕ್ಟ್. ಇಟ್ಸ್ ಕಮಿಂಗ್ಸ್ ಅಂಡರ್ ಜೆನೆಟಿಕ್ ಇಂಜಿನಿಯರಿಂಗ್. Due to genes, because of the genes itself, sees there are in the chromosomes, there are more and more genes are there. Related to eyes, there are lakhs of genes takes place. Related to the eye color, there is lots of genes takes place. Related to the eyeballs, related to the size of the size of the eyes, related to the main color and the eyelashes, eyebrows, related to the different body parts. For only one body parts, lakhs of genes takes role in that one body organs. Only one single body organs, there are lakhs of genes takes the role. Important genes are there. Lots of genes are there related to one single organs. One simple body organs also made up of different number of genes. So due to genes, because of the genes, genetical problems occur and the chromosomal abnormalities also occur and form a complex interplay of multiple genes. See, only genes, for one gene also there is a number of problems occur. If the form of complex interplay of, says there is because the interplay of multiple genes, how many problems occurs. See, because of the multiple genes, ಬಹು ಸಂಖ್ಯೆಯ ಗುಣಾಣುವಿಂದಾಗಿ ಎಷ್ಟೆಲ್ಲ ಸಮಸ್ಯೆಗಳಾಗಬಹುದು. This is the problem is main complex interplay. Complex in the sense because it is very difficult interplay. ಅಂದ್ರೆ ಇದೆಲ್ಲವೂ ಅಷ್ಟು ಪಾತ್ರ ವಹಿಸ್ತದೆ. Genes plays main important role in the disorders and as well as the mean the normality and abnormalities also occur due to the genes. Complex in the sense very difficult interplay. There is interplay of this genes is very important. So to identifying the human genome project's main importance is their main goal is to identify the human disorders because of the and they avoids human disorders because of the genes. So then the environmental factors, not only the genes but also the environmental factors also plays important role in the human disorders. See, not only the inheriting factors, not only the biochemical factors plays an important role in the human disorders, but also the environmental factors also plays an important role. See, it's the mother and father's behavior and neighbors' behavior, socio-economic factors, etc., etc., financial conditions. These are all takes an important role in the human behavior as well as a human disorder. ಇದೆಲ್ಲವೂ ಕೂಡ ಬರೇ ಗುಣಾಣುಗಳು ಮಾತ್ರ ಅಲ್ಲ, ಬರೀ ಜೀವರಾಸಾಯನಿಕ ಅಂಶಗಳು ಮಾತ್ರ ಅಲ್ಲ, ಪರಿಸರದ ಅಂಶಗಳು ಕೂಡ ಮುಖ್ಯ ಪಾತ್ರ ವಹಿಸ್ತದೆ. ದೆನ್ ದ ರೆಫರೆನ್ಸಸ್ the one and only book I have referred. Through this I came to understand that I came to find out the meaning of I covered the whole topic of this pre-diagnostic method. Laura E. Burke's Child Development Books. This is the 6th and 7th edition, Franchise Hall of India. And then I will go through the MCQs. So you have to find out the answers. See, amniocentesis used to accept for dash. Which method? See, find out the answer. Ultrasound maternal analysis. Then dash also offer a new hope for correcting hereditary defects. Same I have the mention over here. Dash also offer new hope for correcting the hereditary defects. I have mentioned already the answers in the while explaining the presentation. Amniocentesis or genetic engineering or maternal blood analysis or all of the above. Find out the answers. Then third one, dash has been performed to repair such problems, scanning, x-rays, ultrasound, surgery. Which methods has performed to repair such problems before the birth takes place? Thank you for all one who listens these presentations. I hope you have understood this topic. Thank you one and all.